good afternoon, everyone. Thank you for joining us on stage 2 of the IHSCM Learning Development and Training Festival. It's been an absolutely incredible day so far. I know it's late in the day and it's that sort of time where we start thinking about dinner. But before we start thinking about dinner, we're going to be asking the questions and we're going to be thinking about what the pandemic has shown us, what the pandemic has taught us. So if you are joining and you aren't part of the panel, please pop yourself on mute. You're more than welcome to have your camera on. If you've got any questions, pop them into the chat box. We will try and address them as we go along. If you are watching this on record, obviously don't put anything in a chat box. We won't be able to answer you there and then, but do get in touch via email if you've got any further questions that you'd like me to pass on to our panelists. So without further ado, I do want to have our panelists introduce themselves, and I'm going to go around as they are on my screen. It just allows me to keep focus that way. So I'm going to start with Fiona.
Hello, I'm Fiona Potter. I'm Interim Group HR Director at CareTech, who are a large PLC operating in the social care sector for children, young people and adults below retirement age. Thank
you for joining us, Fiona. Hayley.
Hello everybody, I'm Hayley Robertshaw. I'm Director of Care and Development for St Martin's Care. We are a residential and nursing care provider in the northeast of England. We have 6 care homes.
Hayley is also the fabulous chair of our Care Leaders Network, as well as part of the IHSCM's Social Care Innovators. So thank you for joining us, Hayley, and giving us your time. James.
Hello all. Yes, so I'm James McLoughlin, Director of TAP Thank and Praise. It's a social enterprise that provides a free-to-use thanking platform which enables the public to more easily and securely thank people in social care and healthcare. And as Adam knows, I'm also the co-chair of the IHSM's Public Image of Social Care Working Group.
And amazing work that gets done in that group. If you are not part of the Social Care Innovators and you do want to be, please do get in touch. We have got 6 fabulous groups that all these discussions happen on a monthly basis as well. So I've now got Richard.
Hi, I'm Richard Kramer, and I'm Chief Executive of SENSE, the National Disability Charity that supports children and adults with complex disabilities. I'm also on the advisory board of CareTech Foundation, so good to say hello to Fiona Potter as well as everyone else. Thank you.
Thank you so much, Richard. And finally, last but not least, and Minni's not here at the moment, so we now have Nigel.
Hi, Nigel Taylor, Group Head of Learning and Development for CareTech. So the same as Fiona, but I'm also Chair of the Adult Social Care Trailblazer Group on apprenticeships. I'm also a T-level group panel member and ambassador, and also represent CareTech with the Adult Social Care or Political Party Group.
Thank you so much for joining, Nigel. So my name's Adam Purnell. I am Director of Social Care here at the Institute of Health and Social Care Management. But for this panel as well, I think it's important that I let you know my other roles and my other experience. So I am an ex-registered manager. I used to run a home care service and a residential care home for elderly people. I'm an advocate for rights for residents, and I'm an ambassador for John's campaign as well, which fights for the rights of people living with dementia to have constant access to their families, no matter what setting they're in, no matter what situation they're in as well. I also run a social care chat show called The Care in View, which we use to elevate the platform of social care, the public image of social care, and anything health and social care related. We want to get those conversations out there, and we've had many conversations over the last sort of 24 months about the pandemic. I'm going to use, for the sake of this panel, post-pandemic or recovery phase pandemic. I know it's still going on. I know that COVID's still out there, and COVID's always going to be out there now as well. You know, whether we're still technically in a pandemic is well out of my my pay scheme. I have no idea. I can't comment on that. But we are in the recovery phase of the pandemic now, and if there's ever been anything to completely change the face of health and social care, it's been the COVID-19 pandemic. Now, in some cases, it's changed it for the better. In some cases, it's changed it for the worse, and we've seen ourselves revert back 20 years. So today, what I really want to discuss is 3 things. So I want to discuss isolation and loneliness, what we learned from the pandemic around that, and not specifically just care homes. You know, I think we forget around the rest of the social care settings in society. I want to look at the public image and support, and then we want to look at the peer support and the sharing of knowledge and what have we learned through the pandemic of that. But I'm going to come down to isolation and loneliness first. And Hayley, if you don't mind, can I come to you as an area manager, regional manager of many services? Loneliness and isolation, what have we learned from the pandemic?
I think our biggest lesson is that we'll never keep families out of our care homes ever, ever, ever again. So we've made that commitment. So regardless what we're thrown at, monkeypox is rearing its head and we're having to do some responses, we'll never say no, ever, ever again. We support Gloria's Law. We reached out to Rights for Residents and John's campaign quite early on for some guidance to make sure that we weren't making decisions that were underpinned by fear, and then we completely flipped our approach to risk management, and we always start with a yes, and then we work back through the risk, rather than saying no and using COVID as our reason to just not even try. I think that's our biggest lesson for loneliness and isolation is we will never ever keep families out ever again. It's not for us to do that. Yeah. It's such an abuse of power for me. What is the point in doing everything we're doing if we can't support our residents to maintain those meaningful relationships with the people they love the most in the world? That's what we need more than anything, isn't it, to live our lives, is to know we're loved and to make sure we have access to the people who are important to us. So I think that's our biggest lesson. We just won't say no, and that comes up. We come up against resistance still, and have to justify our position. But I think the last 2 years have give us real strength in saying no. I think that's also a big lesson from the pandemic. We can't say no, and the world doesn't end.
Yeah. Richard, when it comes to isolation and loneliness, obviously we've got people who live isolated and lonely pre-pandemic anyway, whether that be through sensory impairment, whether that be through disability and social access. What has Sense learned from the pandemic around isolation and loneliness of our vulnerable?
Yeah, so I mean, before the pandemic, 1 in 2 disabled people said they were lonely. During the pandemic, that rose to 2/3 of disabled people, and actually rose to 70% of young disabled people. And disabled people felt left behind when life returned to normal, to use that word, for everyone else. I think I would say a couple of points: that loneliness doesn't discriminate. But for disabled people, they may not have the opportunities to make friendships in the first place, and they're less likely to have support networks around them or to feel part of their community. I would say loneliness is not someone else's problem. I hope we learned that from the pandemic as we've reached out to more people, and I think that it's about little acts of kindness, so offering a priority seat for a disabled person or any seat. It's about being more aware of the world around you. I think the voluntary sector needs to be better at collaborating with each other. Our lack of collaboration and sometimes unwillingness to work together can act as a barrier to disabled people getting together. And government does a few good things, but I think we found that people who couldn't access technology were disadvantaged, and I think technology should be a right, not a luxury. And local government, I suppose, need to prioritise loneliness now in wellbeing strategies, particularly for those not in receipt of social care services. So actually, there's a responsibility on a local, individual, community and government level.
So interesting you say that technology ushered in a new sort of way of communicating through the pandemic and social care, and actually in turn it isolated quite a lot of people who didn't have access to that digital infrastructure, that Wi-Fi infrastructure, or even access to devices. I mean, Fiona, CareTech do some absolutely incredible things for people living in any sort of social care setting. So what has CareTech learned, and what could you recommend we need to think about in the future when it comes to loneliness and isolation?
Well, I think certainly here it's about recognising that the staff were working through a really difficult time, obviously not just at CareTech, but in lots of settings. And really putting in place support for them, so recognising the debilitating mental health aspects that we have for the people that we look after, but for our staff also. You know, having that support network, being there for people, you know, having an employee assistance program, telephone support, but also just through the line management, and recognising that you know, that we are all a team, irrespective of which environment we're working in, whether we're in a head office somewhere or whether we are in a home or a school or a hospital. You're on mute, Adam.
I'm telling you, I'm supposed to be able to do this, and I'm supposed to be, you know, a pro at doing it. I've gotten too used to doing them in person now. You know, this is one thing I think about loneliness and isolation is we're so used to seeing everyone from the waist up, and actually we've forgotten how to interact with people and be there in person. And I've started doing that, and I've forgotten how to use Zoom literally overnight. It's all I'm on Microsoft Teams, aren't I? But yeah, no, talking about that and some of the things you picked on as well, Richard, around the gratification angle of things. I'm going to merge the two and come to James because, you know, TAP is very much that free to use thank and praise platform. It is a gratitude platform. I've worked with you in Lancashire to do an ICS wide gratification sort of campaign. TAP has really gone from strength to strength during the pandemic, and I'm a firm believer that although the pandemic has been horrific and we've lost lives that we shouldn't have lost and we've gone through situations we shouldn't have done, if we don't take those silver linings and we don't take those positives, everything's in vain. And there's been some really good positives that have come out from it, and TAP is one of those positives. So what's TAP learnt about the isolation of specifically staff and people working in the sector?
Yeah, and I should just say briefly that TAP was launched actually in January 2019, so it wasn't actually launched during the pandemic. It was just one of those strange occurrences. But obviously, we've been very busy over the last couple of years, and as Adam said, you know, we've notched up, I think, over 10,000 messages of thanks. We're supporting over 5,000 locations across the country, mainly in health and social care. In terms of isolation, just pick up on the point around staff wellbeing, which of course is our big focus area. An observation was that, first of all, there did seem to be a very strong focus in applauding and praising those, quite rightly so, I guess, in the healthcare sector, but perhaps the detriment of those in social care. And just picking up on the isolation piece, certainly I've been sort of working in the sector now just for 2 years, but what I'm hearing still now are stories of the fact that care workers, care professionals felt quite isolated during the period of the last 2 years because they felt that actually the public's admiration and gratitude was more heavily focused on their healthcare colleagues. And they were very happy that their healthcare colleagues got the praise, but they didn't feel that they were necessarily getting commensurate praise. So you had stories of people coming home in the evening, tired from a day at a care home, and hearing their neighbours clapping and just saying, you know, hello, as they sort of make their way into the house. So there was not that sense of appreciation. What was also quite interesting is that over the last couple of years, we've noted with great interest and probably enthusiasm that actually the social care sector has taken off more so than even the healthcare sector, i.e. we have more social care organisations using the TAP platform and more messages of thanks aimed at social care than healthcare. And we could argue that perhaps that sector was perhaps very much in the shadows generally before the pandemic, perhaps even to a certain extent during the pandemic. And I think finally people have woken up to the fact how vital social care is to society. I think people have finally got it. There've been documentaries. Ed Balls has done his bit. There've been, you know, feature films and dramas, perhaps slightly sensationalist, but nonetheless, we see that overall there is a bit of a change in society's attitude, understanding of social care, which we think is good. I know Adam and the team have been doing some great work around trying to get social care mentioned in the same breath as healthcare, you know, i.e. Department for Health and social care. And I think the more that we can get social care mentioned and visible, will reduce that sense of isolation. And one final point, if I may, we did a wellbeing survey recently with a few hundred of our social care organisations, asking them what they felt were the main benefits of a platform like TAP, which is there to, you know, allow messages of thanks to be passed on to their colleagues via both the public and also peer-to-peer. And they said that what social care needed most support in was around recognition of the sector, which of course praise can do, and then but perhaps more downstream, and something that we can't necessarily enact just yet, is supporting the retention recruitment side of things, because of course that's also very, very key. But I think in terms of recognition, I do think that social care professionals finally have got to the point where they are starting to be recognised a little bit more than they were pre-pandemic.
Thank you, James. Yeah, Nigel, I want to come to you because, you know, head of learning and development. Surely we've got to be thinking now with training. How can we train and develop people more moving forward around the importance of human connection? So, what are the sort of things we should be looking at moving forward to support our teams and support our settings around the awareness and acknowledgement of isolation, and how to put it off?
Well, I think for a starter, you've shifted the dial to around mental health and everybody's understanding of that. Where it used to be a no-go subject, it's now become something we all have to deal with. And going back, whilst my focus is very much on our workforce, very much as Hayley was saying, it's the impact of our workforce, seeing what's been happening to families and those we support, that has a a knock-on effect back to their own mental health and well-being. So that's been on our agenda. We've started developing learning programs around that, and as Fiona says, we've got an employee assistance program and everything else. So we've done quite a lot in terms of that. I think it's also very complex because, as you say, we've got back office as well as frontline staff, and actually in our back office we've got a willingness or volunteering to become hybrid workers, which is this isolation being, carried on if you're not careful. And yet our frontline staff can't isolate. They've got to be in there working all the while in terms of the support. There's a bit of an imbalance in terms of that. And I think that we do have to be careful about this hybrid way of working. You're not interacting with people, you're not go and have the occasional cup of coffee and having a chat. You miss all that sort of aspects. And in fact, even for myself, was quite strange. I worked quite a lot from home in the early days. Made the point of coming into the office as soon as I could. And one of the things I've always said to my wife is that there's a big difference in being at home and sitting in the study or the kitchen or somewhere and being on Teams all day, to actually walk. I'm trying to get a plane now for a garden room or a garden office. I want to be able to walk somewhere to say that's my place of work. So I think there's lots of things that impact onto us, and we've got to recognise that within our workforce, because besides coming through the pandemic and all the loneliness and everything else, we've now got pressures and financial pressures impacting on our staff even more, with all the rising costs. And so therefore we've got to be able to establish some level of support, and not just some kind words. I think, we've got to be able to work out ways that we can reward and recognise our staff even better.
Completely agree, and I completely agree with everyone, everything everyone said. So before we move on to the public image side of things, I want to open it up to us all to have a bit of a sort of couple of minutes free-flowing conversation. What have been the biggest takeaways, and what do we need to do now? Well, if someone's watching this, what is something that someone can do now to change their approach to loneliness or the risk of loneliness? So for me as a provider, mine was I made sure that our IPC procedures made sure that our relatives and people of significant importance, the people we were supporting, were involved in all training. They got that idea of understanding, and we could include them in access even during DNV outbreaks, which for me are a lot more dangerous than COVID outbreaks, because it's harder to get fluids into somebody who's got a cognitive impairment to make sure that they're staying hydrated. So for me, it was around making sure that we didn't just focus on COVID. We took the lessons from COVID and applied it to all scenarios. So yeah, whether it's this new monkeypox threat that the media are trying to push at us at the moment, or whether it is DNV, whether it's flu. What are the biggest takeaways? I mean, Hayley, you obviously knew about John's campaign and Rights for Residents. So What's been your sort of biggest lesson that you've learned and applied?
It's really difficult, isn't it? Because I feel like I've just been angry for 2.5 years. So I could, I think it's about the biggest lesson, I think, is that we that being part of the social care innovators, I think that feeling that we were part of something bigger than just our own experience was really valuable, and I've never experienced that before, because as a sector, generally social care is fragmented. We're not united, and we needed to be united in that to get through it. So I think that maintaining all of those networks that you've invested time in is really important, and being able to ask for support and somebody's shoulder when you need it, because particularly I think when you have everybody's we employ 400 people and they're looking to you to have all the answers on, and that's huge responsibility. And then you have 400 residents and their families, and they're looking at you to either provide them the assurance that their loved ones are safe, but also that they can come in. I also think we always stayed, I tried to keep us right at the edge of what we could do, so that sometimes like I made all of our relatives essential caregivers, and we did that in December 2020, before essential caregivers were a thing. So we made everybody that, whether they wanted to take that up or not. We just made that decision that who's deciding who's essential and who's not essential. That's not our decision to make. So I think COVID gave us a lot of freedom to actually make decisions we probably would not have been brave enough to have made before. So we're taking that bravery and that courage and that confidence moving forward with all decisions, not just related to pandemic activities, around people who are making decisions and I'm talking about residential care, nursing care, not in the community, but activities, people who make decisions about what activities are, people who aren't old. We're making decisions now when we've got no idea of what the reality is of living when you're 80 and 90 and 100. So we're being brave in the decision making about what residents are telling us how they want to live their life, so that they're not experiencing loneliness and isolation, and they're feeling that they have some control when often that control is being taken away from them. So I think bravery, courage, and making sure that you're connected with people who have lived experience of you as a leader in an organisation, and we're all leaders, or care workers are leaders, or having that, being able to reach out and know that actually somebody else in another organisation is experiencing exactly what you're experiencing, but you're only going to know that if you step outside. So registered managers networks, being part of the institute, joining these forums, all of that gives you access to people who know how you feel, and that gives you huge strength and comfort. So I think that's something from the loneliness and isolation wasn't just for residents, was it? I think we all felt lonely at some points over the last 2.5 years.
I think you bring up some really, really fantastic points there, and we'll go on to peer support later on. I'm going to come on to public image now, but the isolation of registered managers really was overlooked throughout the entire pandemic. I remember I finished my stint as a registered manager rocking on the back doorstep of my care home, crying my eyes out pretty much every single day. I'd managed to go 20 months without an outbreak, and then I think I was talking to you that I'd spoken to many people at the time. I went through the most horrific outbreak I've ever experienced. I was doing 24-hour shifts. I was on my own. And you can't communicate. Well, you feel like you can't communicate that to your team because you've got to be a rock for them. You've got to be a support for them, and we need to support people. And then in turn, you isolate yourself because you can't go home and just talk about it all the time because you're worried about home work-life balance. And we become isolated in ourselves as well. So yes, registered manager networks are essential. And the idea of collaboration just comes back to your point, Richard, about how we need to drop some of that ego and to work together. We understand that we are potentially competitions in certain demographics, but we are stronger together. Our voices are stronger together. And if we can if we can have our Berlin Wall moment in social care and take away all of those barriers and actually just work together, the public image of social care might improve. So coming on to the public image, it's For me, it's everything. James, I do want to come to you first, but I also want to put out there that the public image, in my opinion, may be around rebuilding trust. I don't think the public trust care. I don't think the public trust health. I don't think the public trust the government. So what have we learned about the public image of care during the pandemic? And James, what do we need to do moving forwards?
Yes, as I mentioned, I'm the co-chair of the IHSCM's Public Image of Social Care subgroup, and been on it for the last 12 months with Adam and a range of around a dozen or so people that regularly turn up, and a wider network of perhaps around 40. What we did actually quite early on in the pandemic was we did a survey, commissioned a survey amongst social care professionals, but also amongst members of the public as well. And probably the most striking stat that we got was that 90% of social care workers didn't believe that they received the praise that they deserved. And that was obviously quite telling. And what was perhaps just as interesting is that those people from the general public that also completed the survey thought about, were pretty much aligned with that. So there was almost like a sort of a self-reflective understanding that the general public were probably more likely to recognise NHS than people in social care. And that came really from a lack of, and we did probe in the questionnaire, and it came from a lack of understanding, really a lack of understanding. Many people, especially from the general public sector, thought perhaps incorrectly that social care was kind of owned by NHS or whatever. So there was a lack of understanding. There were some, I'll talk about perhaps next steps forward, but there were some enlightening elements of the survey. One was that if a member of the public has had even just a small insight into the world of social care, they were 3 times more likely to want to work in social care, which we felt to be quite a strong positive statistic going forward. And one of the things that we're doing in the public image group is trying to do an education job, educate the general public, and Adam's done a great job through media outreach, educate government, ensuring that social care is seen on the same level as healthcare, different, but equally important. And there've been a number of other initiatives. So, Hayley, you mentioned about the need to be united. The IHSM social care group came up with this brilliant idea around Green Hearts, which might seem a very small idea, but it was all about social care professionals being a united front. So everyone putting the green heart to emulate the blue heart that NHS professionals have, and to demonstrate the same level of pride and recognition in their role. And that's taken off like wildfire, Adam, I think it's fair to say. And these are just some of the small initiatives, but we've also run online events, some physical events. And I know the biggest thing that Adam and his team have pulled off really is this overarching workforce focused people plan. And it goes without saying that the public image of social care is one of the key tenets within that, isn't it, Adam? So we know that public perception and public image isn't the be all and the end all, but we do know that it's a very, very important element within the world of social care, because it's the bridge, if you like, between perception and reality. We need to make sure that people in social care rightfully are recognised for what they do, and we need to challenge perception from the general public, and we need to ensure that the social sector has a united front. And one quick comment, if I may, that came out of our activity, and thanks to Adam, we're now working with an integrated care system up in Lancashire and South Yorkshire. They seem to be leading the way, these ICSs, in terms of bringing together in the community, and I think that was hopefully it's a strong symbol of things to come. Adam, sorry, you're on mute.
Thank you, James. I've got a squeaky chair, and I'm concerned that if I keep myself off mute, all you're going to do is hear it squeak. Honestly, it's terrible. I mean, there is so much that everyone's doing to try and boost the public image of care, or of health and care. You know, we want to try and drop that health and social care, maybe have them together. You know, we are one and the same. We do support each other. Like I say, the green heart, the blue heart, they fit perfectly together. Fiona, CareTech, public image of care. You obviously, like I say, doing quite a bit to raise the profile of care and support people in social care. What has been your view on the public image? Has the clap for carers worked? Has that sort of fake, yes, well done everybody, but by the way, you've not had the vaccine, so now you're all villains, damaged the sector? You know, what's that public image? Where's the trust going?
Yeah, I think certainly in the earlier days when it was first, a clap for carers, I think social care was there with healthcare. As time has gone on, I think it's changed, and it's definitely, the NHS are the heroes, and I feel that social care is a little bit forgotten. It's the same. It's demonstrated. If you look at, for instance, Morrison's, who gave discount through Blue Light Card for NHS and social care and firemen and etc. 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 That's now only offered to the NHS staff, and other organisations that operate in a similar way have changed. And it's like, why? Why is social care not as important anymore? That's sort of how it feels from my personal perspective. NHS seems to be, when we're talking to people about recruitment opportunities, and if we are working with, for instance, the Princess Trust, and we are looking to recruit young people into social care, and we go up against the NHS, all of the candidates will opt to go to the NHS and not within social care. I think there is a perception of what social care is, and in reality, that's not CareTech. Certainly not CareTech.
Talking about placements, Hayley, you do a lot of work around nursing placements and trying to get more social care nurses involved, because, social care nursing is still a bit of a stigma when it comes to progressing that conversation. There's that hierarchical nature that you're a nurse, but you're not an NHS nurse. You don't work in the hospital or the district, so you're not a proper nurse. But you're doing a lot to try and change that narrative. What have you done during the pandemic to try and entice people and show people the wonders of social care nursing?
So we are working with, sorry, who are we talking to?
Sorry, I was talking to Hayley, but you're both welcome to come in on it.
I'll cut out.
Okay. We're training our own nurses through the apprenticeship pathway, and we have discovered that there is zero representation for any social care nursing examples in any of the academic course material. So my trainee nurse associates are all our own staff, so they were all experienced senior care assistants and are now at a local university, and they have huge imposter syndrome because they're sitting in lectures with 90 apprentices who are through the NHS, who are in hospital ward-based settings, and they're not represented at all. Now somebody's a year in, I've got them all, they're all like phased in different stages in the year. But I have a good relationship with the university, and they're open to us. I think they've just never thought about it. It's not intentional. They've just never thought about it. And my trainee nurse associates are the only trainee nurses from a care home out of about 130 cohort, which is also doesn't help, does it, the situation? The Royal College of Nursing are going to work with me to run some day in the life of and a couple of case studies. I have a nurse who started as a care assistant many years ago, left social care, went into the NHS, and then has come back to social care as a nurse. She's a fantastic role model. She's a real champion. And we're hoping that she's going to be a feature as well in the Royal College of Nursing information. So I think our nurses in social care, for me, top trump NHS nurses every time, because they are it. So in our care homes, they are completely autonomous. They don't have other NHS departments wrapped around them to make other decisions or take on other elements of their role. They have to be all things to all people when they're in our buildings. And I always feel really passionate about what they give and how they commit to their role in social care is not given the same level of status or professional respect. And I don't just mean from a society point of view, I mean from visiting community matrons and district nurses who come into our buildings. They don't get the same level of respect. They also don't get the same level of respect from paramedics or from doctors in the hospital, if we've refused to accept unsafe discharge, all of those things, they're not given the same level of professional respect, understanding. They're not listened to. So we're challenged, and it would be very easy, wouldn't it, to just back complaints back and forwards. So I'm actually working with North East Ambulance Service around improving our relationship with paramedics and community teams by creating comfort hubs. So I want our homes to be comfort hubs for all community teams, so they can come and get a hot drink, use the facilities while they're out doing that. Because I think and that's took a lot to be the better person, I have to say, because some of the things that how they behaved is really hurtful and unnecessary. Nobody's not working hard, and nobody's coming to work to do a bad job. Sometimes they make mistakes, you know, but we've got to learn from them and be positive about that. So there's lots of things that we're doing to try and kind of just chip away. I don't know how successful it'll be, but that's the other thing I've learned as well, is that if we want change to happen, we have to make it happen. Nobody's going to do it for us. So that's
switched the light on at the end of the tunnel. That's what you've done. You've switched the light on at the end of the tunnel so people can actually see, oh, there's a pathway now for nurses in social care. And you know, if you can succeed in your area, I'm sure it's something that can be replicated moving forwards. And that's what innovation's about, isn't it? You know, it's taking innovation and trying to apply it elsewhere and making it fit for our current model. Fiona, before I come to Nigel and Richard, do you want to just come in on the social care nursing?
We don't actually do operate in the same way, so no.
Oh, okay.
Yeah. Go to Nigel.
Hi, first of all, I'm not sure we ever had a good public perception, and I think that's part of the problem. If you're talking to parents, do they want their children to come and work in social care? In a lot of cases, they'll say no. Teachers don't know enough about social care to promote us. Social care is a little bit like a pension. You don't know how good it is until you need it. So I think there's a bit of that aspect around it. We're, 1.6 million workforce spread across some 39,000 establishments. So we're totally fragmented. Our workforce, I suppose the big issue is our workforce doesn't have a sense of belonging. And that's one of the things that those who have been working in the sector of frontline would always complain about. We don't have the blue lanyard. We don't have something that people can associate with us or anything else from that point of view. Although there are moves to change all that. You know, for those who are involved with talking to the Department of Social Care and Health, which is what it should be called, we would probably see that things like a knowledge and skills framework, things like having a skills passport that gives us professional status, they're all now back on the agenda. They're probably nothing that any of us haven't been talking about for the last 20 years or so, but now all of a sudden we're starting to get a voice. And I think from my experience of being involved in all this, and Hayley, you know, I feel like the cuckoo in the nest with my health colleagues and Health Education England and all these things, because you know it's prevalent in terms of health all the while, and secondly or even thirdly in terms of social care. And I always go back and say, where would that fit for social care? How does that work for social care? And I become the elephant in the room in terms of that, and make sure they all listen to it. But it is difficult. But one of the things I feel is that since now the pandemic, whether we can sense it as yet, but the government are now taking more notice of social care. There is investment on the way, and I know we've got some of it go to health in the first place, but there is also other investment into the workforce. There is some noise around the care certificate. There is noise around making sure that everybody should have a framework in which they need to achieve in terms of their learning. And there is about making that transferable and having a skills passport and professional recognition. So I don't think we'd have got that if it wasn't for the pandemic, because and I'm sure a lot of us have been saying it. We've been saying the same thing for a long, long time, and nobody's listened. And all of a sudden, people are starting to listen. It's on the agenda. So I think there's been some positive stuff. And we, funny enough, I've just come off a T-level healthcare and science meeting, and lo and behold, we talked exactly about what you're talking about, Hayley, and that there is a different status given to people in a social care setting compared to a healthcare setting by universities. It's about whether things like T-levels and apprenticeships are recognised as the equivalents, and there's some disparation between a healthcare and a social care qualification, even though they are the same level. And again, it just becomes an argument that we look at in terms of not having a social care. Even if you look at leadership, we don't have a social care leadership program with universities, but there's hundreds and hundreds of healthcare ones. So that gives us some idea of where we sit in the pyramid. And we do have nurse associates, we have nursing apprenticeships the same, and again we struggle with how we work with universities and how universities can work with us as an employer. And we're limited to where we can do that within the particular areas that are clinical settings. So it becomes very difficult for us.
There's always a worry when we have these conversations that it just does become the same old that we're discussing. But what's great at the moment is we are coming up with these outcomes. I am going to say that the people plan's obviously changed everything, and that's the reason why the government are looking at the care certificate and transferable skills, and the shortage of occupation lift just before Christmas. I jest, but you are right. We are starting to have these conversations now. Richard, what, in your opinion, do we need to do to boost the public image now? So like I say, let's not rehash the old conversations. The positivity now. You've got the last comment on public image.
Oh God, I wasn't feeling the positive, Adam. But I mean, so from my perspective, I'll set the problem and then I'll set what needs to happen. I think that we know the social care sector was fragile and overstretched long before the pandemic. It's had a disastrous impact on individuals and families. We've learnt that society probably neglects disabled people and their families, and disabled people are very angry, many who are recipients of social care, and it's important that we talk about them. I think what James was saying earlier, that people understand what social care workers do. I think they were touched by their bravery, resilience, and the public gets that social care staff are highly skilled yet lowly paid, and they're beginning to question why. And I want to get back to that at the end. So the three things I would like to say is, first, I think we've all got a responsibility to reframe social care rather than expect government to do so. And that's for us. I mean, Fiona's in the business of hiring. It's about moving away from describing social care as support for washing, dressing and medication. It's much more than that. It's support to enable people to flourish, to be active, independent, enjoy life, try new activities, develop friendships, be part of a fulfilling life. Now I'm interested in working in social care. I think there's a responsibility for providers to reach out to people who would not normally think about social care. And again, Fiona came up with some examples of the Prince's Trust. We're working with Birmingham South and City College to ensure that everyone who goes through their course, on the social care course, gets an interview at Sense for a Job. So it's about taking our story out to different communities. I don't quite get the optimism around social care workforce. I want to see maybe I've missed this, and correct me, but I haven't seen that specific social care people plan. I go, yes, this is a government that is investing in the social care workforce. And that can only happen if you've got pay scales equivalent to the NHS, standardised terms and conditions in lines with the NHS, helping us to improve recruitment and retention in the sector, better career pathways for social care staff and further investment in training. That is a responsibility of us as providers, but it needs to be backed up by government. And I haven't quite seen that yet, despite Nigel's slight more optimistic take than mine. But I guess that's why we're on the panel, to have a debate.
So I'm obviously referring to the people plan put together by the IHSCM and our wonderful members in the social care sector, launched at the House of Lords, and I am meeting with some top MPs to hopefully try and get it into Gillian and Sajid's hands so that they don't have to do the work. We've done it for them, you know. That's the co-production and collaboration that we need to see moving forward. Nigel, yes, please come in.
I think we've got to be careful to align ourselves to the NHS, because they also have about 100,000 vacancies currently and are struggling to recruit and have a poor public perception in terms of how the public view them, more because of management problems than people delivering on the ground. So I think what we've got to be able to do is stand for our own rights and be recognised for ourselves. But there's a big job out there, and I'm not saying that it's all done. And you know, Adam, whilst you have developed a workforce plan, which is great, the APPG has already done a vision and values document. It would probably good to align and look at both of them in terms of that, see, because we do have that linking to parliamentarians through the APPG. It's a process to try and influence. It's not necessarily going to give us all the everybody saying, yeah, let's jump on this and jump on that. There has been, and again, I don't know if anybody was aware, there was a select committee around workforce advice in terms of that, which again, CareTech and myself sat on that, and that's going to Jeremy Hunt around. And that very much everybody on there recognised that there was major issues about this comparison with the NHS and ourselves. We are equally important, in fact, in most cases, more important. And actually, if you think about it, is that, you know, on average, it's about £8,000 a week to put somebody in the NHS hospital. And I vow if any provider gets anywhere near that for providing exactly the same service. So I think there's a hell of a lot that's got to be done, but I think we've got to go for it in our own rights.
Yeah, Hayley.
Yeah, I absolutely agree with that. I think it's about we need to tell our story better, and I think we all, it's a generalization, but we work in care because we want to make a difference, isn't it? We how it makes us feel that we are contributing something, we are fixing a problem, we are supporting people to live a really good life, you know, for however long we are working with them, supporting them. So it becomes then very difficult to look at data and look at numbers and look at outcomes, and how do you measure an outcome when it's a feeling and all of that stuff. And I think that's sometimes where we can tell much better stories. Commissioners love data, they love numbers. So we've started just, and it's really basic stuff, but and it probably, St Martin's Care were a very traditional paper-based provider before the pandemic, and they've been dragged kicking and screaming into some kind of digital position. So we've now got data we've never had before. So forgive me if people are going, we did that 10 years ago. This is like seeing fire for the first time for our organisation. But we do things like tell our commissioners average length of stay. Do you know, what's the outcome from admission to discharge? When they're discharged, are they discharged home? Are they, do you know, what story are we telling? And where's the data that then informs their decision making? So I had to make a decision for my own mental health that I can't change the government. I mean, I use my vote, but that's not effective. But I don't, you know, but what I can do is influence what we do locally. I can influence local decisions. I can influence what we do and how that impacts on the people that we care and support. And then we tell that story. And I think if we all did that as providers, like how much rich data would we have if we shared? I'll share anything. I'm not in competition with anybody. Do you know, I have to have confidence that what we do is brilliant. And if people want to be part of that, they will. But I don't think it's fair that somebody 7 miles down the road is struggling and I have some answers that could help them. Why would we not do that? I never understand that. And that's not because I'm not commercial. I understand the commercial nature of what we do, but our product can help everybody, why would we not want to help everybody? So if people want to know about how you get your funding for your apprenticeship pathway for nurse training, it's not costing me anything. I've got funding for all of my registered managers to do the leadership degree with Arden University, because we have a saying in the Northeast that shy bairn's getting out. And I think for social care providers, we've got to just stop being shy and stop accepting kind of scraps off a plate. And you might get a yes and you might get a no, but it's not a reason to stop doing. So I'll share anything. And I think if we all had that, we'd be a pretty powerful, united organisation that really could make a difference. I really believe that.
Completely, and it's sort of the mindset I had is when we were a 16-bed residential home, and I would offer to help all the other homes in my area, and they, my CEO, my director, would, but the competition is like, yeah, but we've got 16 beds, so if someone can't move into our care home, I want to know that all the care homes in this local area are providing outstanding care, because we need to make sure that the people in society get the best that they possibly can do. Look, we're not going to really have time, I don't think, to touch on peer support, so I'm going to give us all hands up, button, unmute, what have you. So last thoughts on what we've learned during the pandemic and what we need to take moving forwards. Literally open to anyone to unmute and have their say.
More
I'll go first to get it over and done with, then I can relax and hear everyone else's. So I think what this pandemic has taught me more than anything else is actually it brings home the importance of showing your vulnerabilities. I think, as a male chief exec, some of our approach to leadership is hardwired. We're taught to be, on top of it. There's a temptation to say, as some leaders did, that everything will be okay at the start of the pandemic, but that wouldn't have been truthful. I didn't have all the answers. We were fighting on so many fronts for the very survival of our charities, and I think we've had permission to talk about our vulnerabilities and create an environment that is much more conducive to being yourself, bringing yourself to work, being authentic, humane ways of working. I think we've got used to being vulnerable as individuals, as teams and organisations. Yes, it is about my job, it is about running a charity well and efficiently, but it's also about understanding others' perspective, bringing passion to your work, being motivated by empathy and compassion. So as well as, communicating better, we all were communicating so well during the pandemic. We've all introduced things to improve people's well-being. It's retaining those things, and above all, being yourself at work, because that is being honest, clear and transparent, and that's what people expect from you, nothing less from you as a leader. So even when you can't always give certainty and you can't always make promises about the future, being transparent and honest and authentic carries you a long way. And I think I can only say as a male leader, that is so important. And that has made me a better leader of my charity, and hopefully that's affected everyone around me and the people we support.
Thank you, Richard. James.
Yeah, if I just jump in. So as I mentioned, TAP's core purpose is to support social care workers and healthcare workers, of course, equally. So perhaps I'll just give the last word to one of our TAP user organisations over at the West Sussex Partners in Care. This is the development manager who's actively engaged with TAP, supporting her network of 350 care organisations. And what she said is, the importance of recognising the fantastic work people do can never be underestimated. Each and every person who makes a difference to the lives of others deserves appreciation and praise, highlighting the great work that goes on every day in the social care sector. And that kind of sentiment just needs to emanate out into public consciousness, because there is some amazing work going on by some amazing people every single day. And it's as I say, TAP is just one such platform that can hopefully project those positive stories out into the ether and celebrate social care.
Thank you, James. So positivity, I love it. I absolutely love it. Spread the love, spread the love. Nigel.
I think the key is more collaboration, more of this, more of talking to each other, more joined up thinking. The old saying is there, isn't it? If you think of the sector, it's multifaceted, it's across lots of different organisations and supporting individuals. So we're very fragmented, and divided and conquer comes into mind. So I think we've got to bring ourselves together. We've got to unify as one body and talk on the same language, but also tell that story, as Hayley said, because there's some fantastic stories out there. You know, we only hear of when social care is not working, when, you know, when it arrives in the press, or as we've seen in terms of COVID, and even then we got the blame as opposed to the government getting the blame in some cases. So I think we've got to really pull together and stop this sort of silo approach, and it's my homework, I'm not going to share it. We've got to start sharing our work.
Thank you. Now I'm not on mute. I thought I was on mute. Then I thought I was going to do it for like the 15th time this discussion. No, thank you, Nigel. I completely agree. Completely agree. Fiona.
I'd agree with Nigel. I think we're stronger together, externally, but also internally. So, you know, your leadership team working really close together. I think one of the things that I found with the pandemic, you're never done. It's a changing feast. Every week it was something different was happening. Communication, it was critical. Having touch points with your team, you know, which started off daily and then moved to, you know, to making sure everyone's okay, and then moving on to weekly as we got used to that environment, because it was all new for all of us. Yeah, so that's me.
Thank you, Fiona. Finally, Hayley.
Yeah, I think it's about sharing. It's about much more of this. That those will not always agree. Do you know? I think that's okay. That's perfectly okay. But being united as a sector, I think I hopefully will see that in my lifetime, because that's for me is where the solutions will lie. Do you know? We have to stop sitting back. Do you know, we talk a lot. You know, I did my degree in disability studies many years ago, and it was all about people don't want to be passive recipients. Do you know, we talk about, you know, people who they don't want to be passive recipients, they want to be active participants in choices and decisions that are made, and we kind of need to use that ourselves. Do you know, that's really important. Do you know, let's continue to challenge, let's look for solutions, let's not just sit back. I think we have a duty, I think we have a duty, not just for the people we care for today, but what's this going to look like in 10 years if we continue working in silos? We'll be no further forward, and that would just be such a waste. It really would. And then nobody wins, does it? So I think more of this. Do you know, the social care innovators, I think, were massive saviours for my mental health through the pandemic, massively, because that shared experience is so critical. So I would, everybody get your teams, get corporate memberships, get everybody involved. I had a dream, I'll just share this as a funny story, and I have to keep telling myself it's not stand up, but I had a dream at the beginning of the pandemic that I organised a march. Now, I live in Newcastle, so obviously it's a very historical march, the Jarrow March, you know, many years ago, around low pay, and so I had this dream. I had coaches organised, I had everything organised, and we had everybody picking up people who work in care and people who receive care from the northeast all the way down to the Houses of Parliament. And it was so real to me when I woke up. I had to tell my husband, I was like, I've had this most amazing thing we've organised, and he said, you know, I believed you till you said you were going to walk it. I could see it happening until you said you were going to walk it. But you know, that army of people who want change is powerful, and it makes a difference. Yeah. That's something like that I think we should be doing, however we do it.
Completely. It's been a wonderful discussion, this. You know, whether we've got the outcomes and solve all the problems, I don't know. But I think moving forward, you are all right. There has to be, and my favourite letter of the alphabet is C. You know, because it always starts the words that are so important to social care moving forwards: collaboration, co-production, change. Yes, I'll put challenge in there, but I do quite like curiosity as well. You know, let's be curious and let's work together. There's not really anything that goes with money, so I always say cheese. You know, I try and be down with the kids because they say cheese for money, don't they? You know, so I do try and bring that in. One thing I would like to bring to the table to take forwards that I've learned through the pandemic is to value those that we support. And when I say value them, I don't mean invite them to the table and sit down and have a conversation with them and make sure that their views are heard. Let's actually value them. If we're asking them to give expert opinions, let's pay them. You know, let's make sure they are respected exactly the same that we respect people that would come from an organization that get paid by their organization. So it's really about valuing everyone's opinions now. So when we move to integration, it's great that health and social care are having those conversations, but let's involve, again, the letter C, community. Let's involve our citizens. You know, they really do need to be a part of this. We've learned a lot during the pandemic. We can't go backwards. I don't think we want to go back to the old normal because the old normal wasn't working. I don't think we want to stick with the new normal because the new normal isn't working. Let's create something great for the future. And like I say, if we can all just work together, it would be fantastic. So thank you so much for joining me today for this discussion. I think it's cathartic more than anything to chew the cud with like-minded people. And more of this needs to happen as long as we have outcomes as our view. You know, as long as we can focus on outcomes and try and bring an outcome for the future, that's what matters. So thank you, everyone. If you're watching this on Catch Up, please do connect with our panelists on social medias or where have you. And let's continue to have this conversation. Like Hayley says, join us at the Innovators. There's no cost to being the Innovators. Yes, I recommend membership because I think peer support is essential. But let's all join together and pool our resources, and let's not be shy about sharing. You know, let's share and change the future. So thank you so much. And a huge round of applause for Jade today, I think, because Jade has facilitated this magnificent festival and sorted out all the stages, all our panelists, our guests, our topics, everything. So Jade, without you, this would not have been possible. So thank you so much. And thank you everyone for joining us.